So an aneurysm, by definition, is when a blood vessel that is normal size, with the aorta, for example, which is the aneurysms that I treat, which is the main blood vessel that takes blood around the body from the heart. When it grows to twice its normal size, that's called an aneurysm. And aneurysms have a risk of rupturing or splitting, which we call a dissection. An aneurysm could be formed in any blood vessel in the body, but the predominant types of aneurysms are to do with your aorta, which is the main pipe that comes out of your heart. And this pipe goes from the front of your chest to your head, and then goes along your back and into your abdomen or your tummy. And it provides all the branches to the various organs, including the brain and the heart. So the aneurysms can affect the chest, which is called a thoracic aneurysm, or abdomen, which is called an abdominal aortic aneurysm, or both in some cases where you call it a thoracoabdominal aneurysm. And I'm involved in treating all of those aneurysms in an open and with stenting. Yes, aneurysms can potentially be very dangerous. It's a silent killer, because aneurysms, when they grow, you don't feel it because the aorta doesn't have any nerves in it. So when they grow to a certain size, we have set criteria as to when we worry about them more. Then the rate of rupture or death increases by 10 to 20% per year as it goes over certain sizes. So they can present in two ways. One, we could find it incidentally because we did a scan for something else, or others might have some symptoms for other reason and we did a scan for something else and found it, or it could be presenting in a ruptured situation. And the only clue really in patients is if they had a family history, or some kind of a syndrome where it's a genetic reason why you have one, where we tend to look more often and detect these aneurysms in families. The only bad outcome of an aneurysm is really rupture and early death. There isn't any sort of subtleties about aneurysms. They are just simply life-threatening silent killers that should be detected and treated. Aneurysms can be treated in a multiple number of ways. We have some aneurysms that we detect that are twice the size as normal blood vessels, but haven't reached the threshold where we think it's dangerous from a size perspective. And those aneurysms can be treated with medication for blood pressure, lowering pulse, and by regular monitoring by a surveillance program that I would run. The second way of dealing with it is, in certain situations, you can do a stent graft, which is a pinhole procedure where you put a scaffold inside the aneurysm to bridge the aneurysm from a normal part of the aorta to another normal part of the aorta, making all the blood go through the stent and not through the aneurysm, therefore taking the rupture risk out. And that could be a permanent treatment. The more commonest way of treating aneurysms, particularly in the chest, is through a keyhole or open technique, where you have to enter the chest with traditional heart surgery techniques and literally remove parts of the aorta and replace it with artificial tubings that have been manufactured to last forever. And that can be a very successful operation with very low risk if it's found in an elective fashion. In emergency operations, when you present with rupture or dissection, which is a split in the aneurysm, then sometimes the risk could be slightly higher. But the risk of leaving it alone without any treatment is always worse than the risk of treatment. And it is completely possible to have a successful treatment of an aneurysm and have a very normal life afterwards.